It's normal to want to protect your health and stay independent as you get older, especially when it comes to something as potentially painful and limiting as stomach ulcers. Many people over 65 worry about unexpected flare-ups or the discomfort that can come from digestive issues. You might feel uneasy when you hear friends mention the acid reflux pills they're on, or you may recall a time when a simple aspirin for a headache triggered days of stomach upset. If any of this sounds familiar, you're not alone. Our digestive systems become more vulnerable to ulcers as we age, but there are proactive ways to protect yourself without giving up your autonomy. That's why today we'll explore the surprising truths about stomach ulcers, reveal how common misconceptions could be holding you back, and discuss 3 specific proton pump inhibitors that are often recommended to help prevent ulcers and maintain an active, fulfilling life. It's important because a single ulcer can take away your appetite, make social gatherings less enjoyable, and even impact your ability to stay physically active. If you found yourself skipping meals out of fear of heartburn or discomfort, or if you shy away from outings where you can't easily access medication or restrooms, then you know how digestive health can limit your sense of freedom. By learning more about the different ways to manage your stomach acid, you're effectively giving yourself permission to keep doing the things you love. Independence, after all, isn't just about being able to move around freely. It's also about enjoying life's everyday comforts, like a favorite family recipe or a long lunch with friends, without worry. Here's what you can expect to discover as we talk through this together. First, we'll address why so many of us believe ulcers are just a normal part of aging. Then we'll uncover some vital medication management tips that show you how to partner with your healthcare provider in a more strategic way. Finally, we'll take a close look at 3 specific proton pump inhibitors many doctors discuss with their patients: omeprazole, lansoprazole, and pantoprazole. By the end, you'll not only understand how these medications can help guard against ulcers, but you'll also be equipped with key questions to ask so you feel confident and in control. I'm not a doctor, but I've spent a lot of time talking with pharmacists, reading up on guidelines for older adults, and gathering insights from seniors who've successfully managed or prevented stomach ulcers. Think of me as a knowledgeable friend who wants to share what's working for others in your shoes. And I'll also stress that any changes to your medication routine should always involve a conversation with a qualified healthcare professional who knows your personal medical history. As you follow along, consider how these suggestions might fit into your life. If something resonates or you have a different perspective, let us know. We're all in this together, and your feedback can help others who might be facing similar struggles. Now let's dive in and see how we can take charge of our digestive health so that a healthy, active lifestyle remains your reality. Many people have been told that if you take enough antacids or if you avoid spicy food, you'll never get ulcers. This widespread belief can lead seniors to ignore deeper issues until they manifest in serious discomfort. Truthfully, stomach ulcers aren't always about the occasional spicy meal. They're more commonly associated with an imbalance in your digestive environment, often linked to bacteria called H. pylori or certain medications that weaken the protective lining of your stomach. The big misconception is that ulcers are inevitable as you age. But let's talk about why that's not necessarily true and why you have more control than you might think. Picture James, who's 72 and considers himself pretty healthy. He walks every morning, stays social in his retirement community, and eats fairly well. Yet he started experiencing a dull ache in his upper abdomen, particularly after meals. Convinced it was just a minor reflux problem or maybe just the result of getting older, James tried a few over-the-counter antacids. The pain lessened for a bit, but always came back, sometimes sharper. He avoided mentioning it to his doctor until it became too irritating to ignore. When he finally brought it up during a routine checkup, tests showed he had a small ulcer forming. The common assumption James fell for was thinking, it's just another sign of aging. Nothing to do about it. But here's the thing, that ulcer could have been prevented or at least caught earlier. Studies suggest that while the risk of ulcers can increase with age, it's largely because of medication interactions, like mixing NSAIDs or certain anti-inflammatories, and changes in stomach acidity, not because your body inevitably breaks down. Understanding this can be empowering. It means you don't have to live with chronic discomfort or fear of severe flare-ups. So what should you do? First, pay attention to minor, persistent stomach issues instead of brushing them off. Track when you feel pain or acid reflux. Does it strike right after you take your pain reliever for arthritis? Or maybe a few hours later? Take note of whether it disrupts your sleep. Second, schedule regular check-ins with your doctor or pharmacist if you're on medications known to affect the stomach lining, like certain anti-inflammatories or steroids. Simply mentioning any new or lingering discomfort can be enough to prompt a small medication adjustment that prevents bigger problems down the line. When you're proactive, the benefits go beyond physical relief. You also keep your emotional well-being in check because you're not stuck worrying all day about a pain that won't go away. You can enjoy your walks, your hobbies, and your favorite meals without feeling weighed down by uncertainty. It's a small shift in mindset, recognizing that normal aging doesn't have to include constant heartburn or ulcers, but it leads to big improvements in quality of life. Now, there's a lot more to the story of preventing ulcers than just avoiding spicy food. In fact, the next step has to do with how you manage your medications overall, especially if you're taking more than one regularly. Before we get to the specific proton pump inhibitors, let's tackle an equally important point: medication management and how it can significantly reduce your ulcer risk. Have you ever heard someone say, "I just have to take all these pills, there's no choice"? It's a common statement among seniors juggling multiple prescriptions. Unfortunately, that thinking can leave you feeling powerless when it comes to side effects. The misconception is that once you're on certain medications, especially over-the-counter pain relievers or daily anti-inflammatories, there's nothing you can do about potential stomach distress. But that's not the complete picture. Karen, 68, found herself in a tough spot when she was prescribed a stronger anti-inflammatory for her chronic shoulder pain. She also took a daily baby aspirin on her doctor's recommendation for heart health. Within a few weeks, she started feeling a gnawing pain in her stomach that woke her at night. Instead of talking to her doctor, Karen assumed this was just the price she had to pay to stay mobile. It got worse until a friend insisted she see a pharmacist. That pharmacist explained something eye-opening. Certain medications can irritate the stomach lining, and combining them increases the risk of an ulcer. With a simple consultation, Karen found out she might adjust her dosing schedule and even add a protective medication so she could continue treating her shoulder pain without harming her stomach. The new perspective here is that medication management is never a one-and-done deal. It evolves as your needs change. Don't be afraid to ask questions such as, "Am I on the lowest effective dose?" Or, "Could another form of this medication be gentler on my stomach?" Healthcare providers actually appreciate when patients show concern about potential side effects because it allows them to tailor your regimen more precisely. Regular medication reviews, where your doctor or pharmacist looks at everything you're taking, from vitamins to prescriptions, can catch redundancies or interactions that might contribute to gastric problems. How can you put this into action? Start by listing all your current medications, including over-the-counter items. Bring this list to your appointments and ask if anything is known to irritate the stomach or if certain drugs can be spaced differently to reduce stress on your digestive system. If you have chronic pain and rely on NSAIDs, investigate whether you should pair them with a protective medication. And if you're a coffee lover, don't panic, but talk about how your coffee consumption interacts with your pills. Sometimes small tweaks, like changing when you take medication relative to meals, make a big difference. Aside from the obvious physical benefits, fewer stomach aches and ulcer risks, there's a big emotional payoff too. You get peace of mind. Instead of feeling trapped by a medication routine, you're working collaboratively with your healthcare team. This sense of involvement can reduce stress and help you feel more independent and in control. That's a key factor in retaining your sense of autonomy as you age. Before we move on, I'd love to know, what's one question you've always wanted to ask your doctor but felt hesitant to bring up? Sometimes just articulating those concerns can spur you to take that next step. Feel free to share or jot it down for your next appointment. Now that we've addressed misconceptions and the importance of overall medication management, let's discuss something more targeted: proton pump inhibitors, PPIs. These medications are often used to lower the amount of acid your stomach produces, thereby giving ulcers a chance to heal or preventing them from forming in the first place. Omeprazole is probably the most recognized PPI out there. You might see it over the counter or be prescribed a higher dose by your doctor. The widespread assumption about omeprazole is that it's only for people with severe acid reflux. And if your heartburn or stomach issues aren't that bad, you don't need it. But here's the twist. It can be used as a protective measure if you're at high risk for ulcers, especially if you must take certain anti-inflammatory medications. Many seniors are surprised to learn that taking omeprazole doesn't just reduce immediate acid-related discomfort, it can help your stomach lining stay strong over time. Consider Martin, who's 70 and living with arthritis in his hands. His rheumatologist recommended a daily anti-inflammatory. Concerned about ulcers, since Martin's father had severe stomach issues at the same age, the rheumatologist also suggested a low-dose omeprazole. Martin initially thought, why add yet another pill to my life? But after a few months, he noticed he felt more confident taking his arthritis medication because heartburn was rarely an issue. He could enjoy his coffee again, knowing it wouldn't interact negatively and cause burning pain later. So how exactly does omeprazole help? It reduces the acid production in your stomach cells. When there's less acid, the chance of an ulcer forming from irritation diminishes. This is especially important if your stomach is already under extra stress from other medications, or if you're dealing with a bacterial infection like H. pylori. It's not a cure-all. If the underlying cause is a bacterial infection, you might need antibiotics. But it's a valuable tool for management and prevention. What should you ask if you're considering omeprazole? Talk to your doctor about how long you might need to take it. Some individuals use it short-term, while others might benefit from longer courses. Also ask about possible side effects like headaches or nutrient absorption issues, because these can become relevant over extended periods. Different people experience PPs differently, so that's why a personalized approach matters. The beauty of omeprazole is that it lets many seniors continue with their daily routines, taking medications, enjoying occasional treats, even traveling, without constant digestive concerns. That in turn keeps you feeling independent because you're not stuck worrying about where the nearest bathroom or pharmacy is. You can plan your day around what you actually want to do, rather than tiptoeing around potential acid flare-ups. Let's keep the momentum going. We've talked about how omeprazole might fit into your plan, but it's by no means the only option. Lansoprazole is another PPI that some individuals find helpful, especially if they need a slightly different formulation or dosing schedule. A lot of people think all proton pump inhibitors are exactly the same. While they function similarly in terms of acid suppression, there are nuances. Lansoprazole, for instance, can sometimes come in dissolvable forms that might be easier for individuals with difficulty swallowing pills. The misconception is, if I've tried one PPI and it didn't work, the others won't either. But that isn't always the case. Different people respond differently to subtle changes in medication structure or release mechanisms. Let me share Rachel's story. She's 73 and has endured off and on heartburn for years. Her doctor initially put her on omeprazole, but she found it gave her mild headaches that didn't go away. Instead of dismissing all PPIs, Rachel asked if there was a substitute. That's how she ended up on lansoprazole. She found the dissolvable version easier and more convenient, especially because she also deals with mild arthritis in her hands, making it tricky to open pill bottles. Within a few weeks, her nightly heartburn subsided, and the headaches were less frequent. This small adjustment meant Rachel could keep up her beloved evening gardening routine without discomfort. She still checks in with her doctor regularly, but she's far more at ease knowing she's protected from potential ulcers. One of the advantages of lansoprazole is its flexibility. Some forms are over-the-counter, though you should always consult your healthcare provider before starting or switching. Ask them about the best time to take it, morning or evening, and whether you should take it with or without food. Lansoprazole can be effective for healing existing ulcers and preventing new ones, and it can be a good fit if you need a longer-term approach or if you're balancing multiple medications. The main takeaway: don't assume that one unsuccessful experience with a certain drug means you're out of options. Proton pump inhibitors each have slight variations that can matter for your specific situation. This attitude of "I can adapt" supports your overall independence by reminding you that even when challenges arise, you have choices. You are not stuck and you are not powerless. When you find the right fit, The benefits go beyond ulcer prevention. You can sleep better without midnight acid flare-ups. You might regain your appetite for foods you'd been avoiding, and you can engage more fully in social or family events, which lifts your mood and keeps your life active. By the way, if you're finding this information helpful, take a moment to think about someone else in your life who might benefit. Sharing knowledge can open doors for others too. Sometimes just knowing there are options relieves a lot of hidden anxiety. Let's move on to pantoprazole, the third PPI we'll look at. You might see it prescribed for people who need an even gentler or more targeted acid suppression. The misconception many hold is, if I don't have severe heartburn, why consider pantoprazole? Actually, it's often used in cases where the goal is long-term prevention, particularly in older adults who might be at heightened risk for ulcers due to chronic pain medication use or other conditions. Think of Lorraine, 74, who's been on a steady dose of steroids for an autoimmune condition. Her specialist warned her that steroids could weaken the stomach's protective lining, putting her at higher risk for ulcers. Initially, Lorraine was anxious about adding yet another prescription. She worried about drug interactions and potential side effects. However, after a detailed conversation with her doctor, she understood that pantoprazole could be a real asset, letting her continue the therapy she needed for her autoimmune condition without fear of harming her stomach. Sure enough, a few months in, Lorraine's routine checkups showed no signs of ulcers. That boosted her confidence and kept her feeling in control of her health journey. Pantoprazole typically comes in tablet form, and much like other PPIs, the timing and dosage can be adjusted based on your needs. It has a good track record for healing erosive esophagitis, damage to your esophagus, which can also be a precursor to ulcers in some cases. Since each person's digestive chemistry is a bit different, some find pantoprazole less likely to cause side effects like mild diarrhea or bloating, whereas others might prefer a different option. It all depends on how your body responds and what else you've got on your medication roster. If you're curious about pantoprazole, the practical steps to take include asking your healthcare provider if it fits with your current conditions and other drugs. Discuss how often you should have check-ins to monitor its effectiveness. Maybe you'll only need it for a few months, or it might become part of your longer-term plan. The emotional side of this is crucial. Taking a PPI like pantoprazole can spare you the ongoing stress of worrying that your existing medications might be damaging your stomach. That mental relief combined with physical relief goes a long way in preserving your sense of independence. We've now seen how omeprazole, lansoprazole, and pantoprazole each offer different benefits and considerations. Rather than feeling overwhelmed, think of it like having 3 different tools in your toolbox. Depending on your situation, especially which medications you already take, how your body reacts to certain treatments, or whether you need short-term or long-term coverage, you and your doctor can choose the best fit. At this point, you might be thinking about next steps. Perhaps you're already on one of these medications and want to fine-tune how you use it. Or maybe you've been leery of starting a PPI, but you're curious about how it might prevent painful ulcers and give you more freedom. Let's pull it all together and clarify a path forward so you can continue living the life you treasure. Before we wrap up, consider a quick self-check. Is there anything about your daily routine, like certain foods you eat or the way you space out your pills, that might be contributing to stomach issues? Jot that down as a conversation starter for your next medical appointment. These small self-assessments can be incredibly empowering. You now have a deeper understanding of how ulcers can develop and what steps can keep your digestive system in better shape. We've looked at the false belief that ulcers are a natural part of aging. We've covered why medication reviews are essential, and we've examined 3 proton pump inhibitors, omeprazole, lansoprazole, and pantoprazole, that might help prevent or manage ulcers. This knowledge is more than just information. It's the key to maintaining your independence. When you're free from the pain and anxiety of ulcer flare-ups, you can spend your days as you choose, whether that's exploring a new hobby, taking a walk with friends, or enjoying a hearty meal without second-guessing every bite. The best part is that you don't have to tackle these decisions alone. Your doctor and pharmacist are there to partner with you, ensuring that your treatment plan evolves as your body's needs change. Now is a great time to take action. Don't wait until a small gnawing pain becomes a full-blown ulcer. Instead, schedule a medication review, bring up any concerns about frequent heartburn or discomfort, and talk about whether a PPI might be worth considering. Even if you decide against it, you'll walk away with a clearer sense of your options. You might also talk to loved ones who take over-the-counter pain relievers or daily maintenance medications. Ask them if they've heard about PPIs or had a medication review recently. Encourage them to be proactive too. For those ready to dive deeper, there are multiple levels of engagement you can consider. One easy first step is to simply share this information with someone else who might benefit. If you're feeling more confident, prepare a list of questions to discuss with your doctor at your next visit. And if you're the type who likes to go all in, you might read up on lifestyle factors like dietary fiber intake, moderate exercise, or mindfulness practices that can support a healthier digestive system alongside any medication plan. Just remember, you're in the driver's seat. Aging is inevitable, but losing your autonomy isn't. By staying informed and asking the right questions, you can prevent complications like stomach ulcers from dictating what you can and cannot do. Trust your instincts, collaborate with your healthcare provider, and keep seeking out the knowledge that helps you live life on your own terms. You've made it this far with resilience, wisdom, and a desire for independence. Don't let fear of ulcers stand in your way. Here's to your continued health, comfort, and most importantly, your freedom to enjoy every moment.